Welcome to Language Access Matters, the podcast that dives deep into the crucial role of language access in public services and businesses. I am your host, Carol Velandia, and I invite you to join me on a journey of discovery and empowerment. Language access is not just a matter of convenience. It is a fundamental human right and the key that unlocks doors to essential services and opportunities. In this podcast, we'll explore the far reaching impact of language access, examining how it shapes not only healthcare, justice, and education, but also the world of business. Through thought provoking interviews, insightful discussions, and compelling stories, we will unveil the power of language access. We will hear from professionals who bridge communication gaps to provide quality care for diverse communities. We will explore the intersection of language, law, and justice, and the crucial role that interpreters and translators play in ensuring fair and equitable treatment. We will delve into the challenges and innovations as well as how language access opens doors to effective communication and inclusion and how it makes our society more equitable. But our exploration doesn't stop there. We will also uncover the profound impact of language access in the world of business. We will hear from entrepreneurs, industry leaders, and experts who understand the value of inclusive and effective communication and how it drives success in today's global marketplace. Language Access Matters is your platform to understand the significance of language access in these vital sectors of society. We will shed light on the barriers faced by individuals and communities and the innovative solutions that promote inclusion and equality. Whether you are a healthcare professional, a legal expert, an educator, a business owner, a linguist, an advocate, or simply passionate about the power of language, this podcast is for you. Together, we will navigate the challenges, celebrate the victories, and advocate for a world where language access truly matters. So, join me on this enlightening journey as we uncover the impact of language access in healthcare, justice, education, and businesses. Let's amplify the voices of the 25 million people that don't speak English in the United States and those that don't speak the dominant language around the world. Those voices deserve to be heard and empowered, and we need to empower ourselves to build a more inclusive future. Welcome to Language Access Matters. Let's embark on this transformative exploration together. Chris Hutchins is the founder and CEO of Hutchins Data Strategy Consultants, a healthcare-focused advisory firm that designs AI, data governance, and analytics strategies for health systems, payers, and health tech companies. Drawing on more than 20 years in senior roles such as Chief Data and Analytics Officer at Northwell Health and IT leadership at Massachusetts General Hospital and Mass General Brigham, he has led large-scale data platform modernization, cloud migration, and analytics transformation initiatives. Through his consulting practice, speaking, and his podcast, The Signal Room, he helps leaders scale AI responsibility with an emphasis on data, trust, clinical workflow alignment, and measurable outcomes in patient care. Language Access Matters, as you all know, is the podcast where we explore how communication, equity, and systems design shape real patient outcomes. Today's conversation is at the intersection of language access, patient safety, and responsible AI. My guest, Chris Hutchins, brings a rare systems level perspective shaped by decades inside some of the largest healthcare organizations in the country. Chris and I have discovered a strong synergy in how we work together, centered on helping healthcare systems reimagine language access, not as a regulatory checkbox or back office function, but as essential clinical infrastructure. In this episode, we explore data trust, AI governance, while underscoring a critical truth. Communication may be healthcare's most powerful diagnostic tool, yet it remains one of the least protected. I'm thrilled to welcome you, Chris.
Carol, thank you so much for having me. It's been fun getting to work together over these last few months, and I couldn't be more excited to be talking with you this morning.
Yeah, likewise, I have learned a lot from you, and I want my audience to get to know you and learn more about AI and what responsible AI is all about. So, tell us a little bit, why should language access be understood first and foremost as a patient safety function rather than compliance or just an administrative task?
I love this question. There's so many different aspects to what it takes for someone to feel psychologically safe. I think that's the piece that I want to make sure that I don't forget to really talk about, because it really does impact patient safety when a person does not feel comfortable, or they don't feel like they're being heard or they're understood. Oftentimes, and I know you've used this analogy before, but it's really around what is it, what do you need to do to make sure that people can access the care? For example, so we have a front door to the clinic, but there's a steep stairwell there, and if someone can't walk, how are they going to get in, right?
Mm-hmm.
It's not even about in healthcare. It's not even about the access from a availability standpoint. Can I get an appointment? But can someone actually understand me well enough that they can figure out what is it that I'm describing? If I've got some pain and I'm trying to tell you where it is, other than pointing, how are you going to understand that?
Yes.
If there's medical history that you need to know as my physician, and you can't understand me or I can't understand you in a way that I can communicate that introduces a really high risk for bad outcomes. So this is not even about checking the box. This is the basic foundational things that you need to do to provide responsible care. Communication is key, and I love that you're so focused on it, because it's an issue that I don't think gets nearly enough attention, especially now that we're talking about using AI for things, even prior to a clinical visit. Now with the recent release of ChatGPT Health, it's more important now than ever.
Yes, and I think now that AI is so prevalent and of course it lowers cost, I think we tend to forget that particular aspect, which is the human connection, as you described, and the accessibility portion.
Yes.
I will tell you that one of the experiences that I had working as an interpreter for one of the largest hospitals in the nation, was that as soon as the patient heard their language, spoken by an in-person interpreter, they would
Hmm.
not just soften, but also start saying really what brought them to the clinical encounter. I remember this one experience
Right.
where even when we met at the very beginning, and I used to work for a teaching hospital, so there are several levels of attention, right? Sometimes it is
Hmm.
the resident that sees them first, but then there is also the technician, and there is also the nurse, especially if you're going to go for a surgery or for
Right.
a prep of some kind. And I remember that not only the patient softened when he heard his own language, but also the important information only came as we went through all the different stages, right? What he was supposed to say at the very beginning only was
Hmm.
actually explained
Right.
towards the end, when he felt already that he had created some kind of rapport and felt more at ease with the clinical encounter. So this part is
Yeah.
probably never going to be replaced by AI, in my opinion. So we need to continue emphasize that aspect of the human connection. I'm so glad that
Yeah.
you, even though your sort of your
focus is on AI and all that, you are also focusing on all the ethical aspect of AI. Yeah.
Yeah, and this is such an important point because there's a lot of reasons that people may or may not share things in a clinical setting. Some of it can be cultural, some of it can be religious, but at the very least, we want to make sure that we remove as many barriers as we possibly can to make that person feel comfortable. I
Yeah.
mean, your example is wonderful for that because this is a this is a natural human reaction when you're just getting to know somebody. Even you don't open up and share everything. People aren't comfortable to do that. I know I'm not. So
Yeah.
it's even more important as we think about, that we're in a world now that feels much smaller.
Hmm.
We're encountering people from different countries, different cultures, different languages being spoken increasingly now, more than ever, especially in the United States. So it's really important that we don't assume that we've got these things covered, and you can't do it. You can't manufacture humanity. I think that's one
Right.
of the things I want to talk about. And there's a reason people are concerned about artificial intelligence taking the jobs, but I just want to remind people it's in the name. It's artificial. It's not real. That's a
Yeah.
really important distinction to make. It can't feel, it can't reason, it can't rationalize things. It doesn't even understand sometimes the most basic things, even as we're using it ourselves. It
Hmm.
clearly has difficulty with the context that we might provide it for almost anything that we do. I'm
Totally.
sure that some of your listeners have had these fun experiences too when you are working through a set of prompts and you're very explicit in what you want it to do or not to do, and the very next thing it does is the opposite of what you've told it. And when
Right.
you recognize it, it's, oh, that was a good catch.
And I think that when we talk about that humanity aspect, the sometimes the issue is that we consider these kinds of human aspects as soft qualities, right?
Yeah,
And that
right.
also has a danger. So from a data strategy perspective, what risks emerge when language access is treated as soft operational work instead of core critical infrastructure?
I love that. It's this. This is an important one too because the inputs that you use is what really is going to drive the results that are coming out of it. And any assumptions that you make means that you're probably not putting enough information into your models.
Mhm.
If you don't realize that, you're creating bias by omitting things that you shouldn't omit, and that's probably the most important aspect of bias. That at least is the one that concerns me the most is what the AI does not know, because it operates like it has the information that it needs, and it assumes that you would have told it if it was important to you. That's a wrong assumption. There's nothing magic about AI. There just isn't. So we really need to make sure that we're thinking about what are the assumptions, and let's not leave those in hope that someone else thought of it. Because they're not going to. It's really up to us to make sure that those things are accounted for,
Yeah.
especially when it comes to the multiple languages. There's nuance in every language.
Hmm.
I don't know how people even manage to navigate the transition if you've been speaking a bunch of different languages and you have to learn English. And English is different in the U.S. than it is in any other English-speaking country.
Yes,
It's
all the
really,
cultural
really
aspects. Yeah.
messy, right?
Hmm. Hmm.
I mean, two and two. Okay, well, there's three different meanings there. That's just one of the most basic examples, but there's lots of others. So these things are important. And one of the interesting things when we're talking about language is even the use of slang is a problem for large
Yeah.
language models. Um, you know, at one point when something was bad, it was really bad.
Hmm.
But if someone
Yeah.
tells me that I'm bad, they're basically telling me that I'm cool, which
Yes.
is probably not the case, but it's but it's an example of what I'm talking about and why it's so important. We cannot make those assumptions. We have to make sure that we're explicit, and we do this on purpose. We have to design with access in mind and equal access in mind. So the language is not an optional nice to have; it's an imperative.
Yes, and I've heard you emphasize a lot data trust as a foundational
Hmm.
aspect of AI analytics. Do you have any
Yes.
examples of how does unreliable data or missing language access data, for example, undermine trust in clinical decisions and AI outputs?
There's there's a bunch of different types of ways that this can manifest. I think context is probably one of the easiest things to frame, because I think it kind of gets to why it's so important that we don't take things for granted when we're dealing with this stuff. If you were to go into a, a chat GPT session, for example, and you say, I'm being offered this job as a data scientist, what should I ask for a salary? Well, chat GPT or whichever model you're using, it's going to make some assumptions about you based on what it thinks. Like, for example, it's if it thinks you're a male, it's going to give you one answer. If it thinks you're a female, it's going to give you a different answer.
Mm. Mm.
The answer is based on facts,
Mhm.
historical facts. Without proper context, it's going to go ahead and give you those numbers, and they could be drastically different, and it's not appropriate. But
Right.
the
Wow.
model does not know that. So without context, it's going to steer you in a direction that you don't want it to be steering you in. So you got to understand what it can and can't handle. So if there are norms that have been changed, whether it's policy driven or culturally driven, you need to make sure that you're bringing that information into the conversations that you're having with the models that you're using. It's got to be there, because if you don't think about it and build it intentionally, these are going to be the things that are going to be problematic. And you know, the practice of medicine is just that. They call it practice because it's an evolution, it's an evolving science. It's
Yeah.
always been that way. And we have to think about things in that way when we're designing systems that use AI that's going to be doing any kind of draw you to any conclusions or provide any kind of guidance and recommendations to you. It's got to be not only factually driven, because facts aren't enough, because you and I both know facts can change, and they often do. You really have to have a clear idea of what you can and can't expect it to do, and these are these are things that it's not easy stuff. It just isn't, and we have to make sure that these kind of conversations that you and I are having, we keep having them, and they need to be in a public forum as much as possible.
Do you see healthcare systems including information on language access for patients, or where should this information go? Where should language preference, interpreter use, communication modality, where should they go in the sort of the risk dashboard?
I think they should be front and center in most organizations. There's probably not that many places in the U.S., for example, right now, where they're not dealing with a very diverse populations and center. There's people from every culture and speaking virtually every language. Where I was working at Northwell, you mentioned earlier, um, you know, the language preference, communication preference, these things are all things that are items that are captured in the registration systems, and they're in the electronic health record, and they need to be there. Um, when I was in New York, I believe the last number I heard was about 122 different languages were being spoken in and around New York City, where the health system was that I was working at. And there was a team of people that were really tasked with making sure that they had the resources on standby and available 24/7 for any language that was needed based on who was coming through the door that needed treatment. There were some capabilities that were deployed essentially for an emergency situation where if you don't have somebody available immediately, you've got at least got some capabilities to help drive the initial screening of a patient so that you can figure out how to help them. But these are things that really need to be built into every aspect of what you do, whether you're running a call center, your emergency services functions. every system has to be able to capture this information. And with somebody coming in an emergency, that's not the time to try to figure out, gee, what should I do about, making sure I have this capability. It's too late. So
Yeah.
I think this is urgent as far as I'm concerned, and people need to be thinking about it. If you're not, you need to get on that now. It's really, really important because people are coming from different places. This has been going on for a very long time. It's not
Yeah.
new.
No, it's
And we
not
can
new.
have public policy conversations about, yes, English is the primary language in the US. Well, that's great, but that's, the reality is there are multiple languages here, and you don't wake up one day and all of a sudden become fluent in a new language. We need to make sure that we meet people where they are, and we build our
Yes.
systems to include everything that we need to in order to be able to help every individual that comes through our doors, or that maybe our emergency services people may find at an automobile accident or whatever. It's got to be throughout a whole organization. You've got to have these things built into it.
And I love that example that you bring up from New York. And I wonder how many more examples like that exist, right? Uh, and I wonder if you have seen the tendency rather on the opposite direction, that instead of collecting that data, they just rely in multilingual AI tools. And if so, I guess my question is, when these language barriers exist, what is your biggest concern about this growing tendency to just rely on multilingual AI tools instead of, let's say, professional interpreters or professional translators?
This is an important one because the reality right now is there's not a lot that's been done. The AI voice agent capabilities that I've been looking at, and I've definitely been hearing about some different ones. Um, there's no there's no human connection kind of concept in there, so there's no sense of empathy. The things that are really important that you mentioned, the human connection. The capabilities really have not been designed for that. Um, and honestly, the big players in this space are still primarily focused on English. Um, I've seen a couple of companies that have products right now, relatively new, two different ones, and they've actually gone already down the pathway of starting to build modules to incorporate various languages. One of them, I think, the last count was there were over 30 languages that they'd already accounted for.
Mm.
But it was really in three main areas. So it's not like for a whole healthcare system, but like for things that are actually personal, like your dietitian kind of a capability. There's a fitness capability, and there's a mental health capability. So in those three areas, they've made sure that they're building right from the beginning. Before they've even launched the product, they had already started to build these modules in there to have some capability. Um, but there's still no empathetic side of it, and that's where healthcare has to be different.
Hmm.
We have to make sure that we're not trying to trick somebody into thinking AI is as good as a human being. And I think we have to do things deliberately to guard against it because people trust too easily, whether it's their computer, whether it's their smartphone. Early on, maybe they're skeptical, but it doesn't take very long for them to get comfortable. And that's where I think it gets dangerous in healthcare. We really
Yeah.
need to make sure that we don't make it easy for people to just get complacent. We can't
Yeah.
afford to do that.
And I bet that's a big challenge because, um, for example, what I've encountered working with medical professionals is first that they don't even remember more often. I mean, they don't remember frequently that they have an ethical obligation to communicate effectively with the population that they serve, the communities that they serve.
Right.
They don't remember that in the first place. And I say this based on the attitude sometimes I get from physicians or nurses or other clinical personnel, where they think that if the person has been in the United States for a number of years, they should speak English. And it's a
Mhm.
bother to them to have to use interpreters. Even even when interpreters might be the only way to effectively communicate with that patient, right? So
Right.
this creates a lot of concern to me because I have the impression that the push is almost always to just avoid having to have the interpreter, whether because they think it is an additional expense or because it slows down the encounter. And even if that were true, let's say it slows down the encounter, the most important thing is that the encounter is effective, that the diagnosis was in fact correct based on the
Hmm.
communication. So I have that concern, and I ask
Yeah.
you, like, how should AI and ambient technologies be evaluated so they support interpreter access and documentation rather than trying to displace human-led communication?
And I love this question. The, there's things that are they need to be thought of as the cost of doing business, and sometimes they're not. In my area of specialization, on the data side, for example, companies will pay millions and millions of dollars for the technology, but when it comes down to me telling them that the data is not fit for use, it's a mess, we need to invest in some things that will help us with data quality, that's a harder conversation. But it shouldn't be, because this is, again, it's a cost of doing business. The reality is, if you're in the healthcare business, first do no harm is what clinicians actually commit to when they come out of medical school. So part of not doing harm is making sure that you are prepared for the people who are going to need to be helped. Uh, people, disease, accidents, life, they happen to everybody. It doesn't matter what language they speak. I mean, we all go through the same things. So we really have to make sure that we account for that. Um, if you were to go, well, actually, you can see this on the news every once in a while. They'll show, clips of the UN and the conversations that are going on there. There's an earpiece on almost everybody in the room, and they're listening to real-time translation. It's
Mhm.
because they understood that this is not nice to have. People really do need to have the ability to understand the communication that's going on. And we need to do a much better job of hardwiring that into our thinking when it comes to how we're providing care and how we're prepared to provide care in a clinical setting. And the human connection, you mentioned this, and I've talked about this a lot. It's the most important part of the clinical interactions that are happening between a patient and their physician. There's got to be clarity, because there's already a language barrier in that medical terminology most of us don't understand. So, if we're
Yeah.
dealing with that barrier, then the basic language barrier that we're talking about in terms of understanding, you know, the, there's 58 million people in the United States minimum that are Spanish speaking as their first language. Well, I don't think it's a good idea that we don't think, how are we going to accommodate them and help them feel comfortable to tell us what they need when they come in for care.
Yes, I think
You
that
know?
number is very important. And there are 68 million that speak other languages other than English at home,
Mhm.
and also 26 million people that don't speak English or speak English less than very well. So it's a significant
Right.
number. Is 9% of our population. And let me say that I love the example of the UN because it sort of makes us humble that language is not, or language differences or language barriers is not something just relegated to those that didn't want to learn English or those that are
That's right.
immigrating. Or it's not only that. You can really face a language barrier once you're out of your context. and
That's right.
and if we can see that so obviously, like not only in the UN, but also when the president meets with a president from another nation and they have to have an interpreter there, there is
Yeah.
obviously a language barrier that they are overcoming. So we really need to take the stigma out of the language barrier situation. And the other
Right.
thing that you said that I love is that communication is really what helps that interaction be successful. And I would add that when there is no effective communication in the clinical encounter, you're really, or in the human clinical encounter, you're really doing veterinary medicine. And because, you can't speak really, or you can't communicate
Hmm.
effectively with a pet. And we,
Right.
we should, because we have the language, we should not do that with the
That's right.
humans, right? So very important points that you bring here. And that actually makes me think about my next question, which is about governance. What kinds of governance policies should be non-negotiable to ensure that AI tools do not widen disparities for patients with limited English proficiency or deaf and hard of hearing communities?
This is a big topic, but I think the very foundation of this really comes down to back to the Hippocratic Oath first do no harm. Well, how do you ensure that you're not going to? And the short answer there is you can't be sure. So in order to make sure that you're giving your a patient the best opportunity for good outcome,
Mhm.
you need to make sure that our focus is on enabling that interaction between the provider and the patient. If it's not enabling that, streamlining it or taking out friction, leave it where it is. You don't want to go there. It's not worth the time to do that. If you ask clinicians, nurses, care teams what their pain points are, they can tell you what they are because they're dealing with them all the time, and oftentimes they're dealing with things that we've introduced with the intention perhaps of streamlining and helping them to be more efficient, but that's not really what we've done. We've actually essentially we've shifted a workload from one place to another. Maybe it's another type of a role that's handling it today, but we didn't actually relieve it. It's still there.
Mhm.
When it comes to anything or that's related to the interactions between the patient and their clinician, enabling quick processing of information, accelerating the the review of the information so that you're able to get to the meaningful parts of the engagement sooner. I think that's the kind of stuff that we want to do. We want to enable better human judgment, better informed decisions, but we don't want to lead the witness. I apologize for using kind of a legal term, but you don't ask the question and then start with the answer. Um, this is
Very
what
true.
we tend to do with technology. We need to be very careful that we don't do that, because again, you're thinking about historical data. You've got all this great set of facts over here, but without proper context, you're going to come to the wrong conclusion. Acceptable ratio. But we've got to be really, really careful to make sure that we're aiming uh, our efforts in the right places. There's plenty of opportunities to make things better and more efficient. We do not want to try to substitute clinical judgment with
Yeah.
AI or any other technology.
Yeah, isn't it alarming how we treat, for example, cybersecurity attacks with
Hmm.
all the weight of the policies of an organization? They're
That's
really
right.
bad, a cybersecurity attack or a data breach. These are treated with seriousness and concern, right?
Hmm.
And I find it even alarming that language access failures are not audited the same way when they can cause so much trouble, right? You
Yes.
can well, maybe you cannot cut the wrong leg because probably the doctor, if he's not only going by the chart, may or the wrong information at the moment, maybe that mistake won't happen. But there are so many mistakes
Right.
that are life altering, right? And
Yes.
that are based on poor communication or lack of language access. And I wish that they were audited with the same care and seriousness as cybersecurity incident or even all the clinical adverse events, which, by the way, many or a proportion of those clinically adverse events occur because of lack of effective communication. So, is there anything else that you think should change in terms of governance and accountability, other than that um, lack of awareness?
I don't know specifically what it would take, but it's certainly a conversation that I think is worth having. And I'm glad that you and I have met, because these are things that maybe we can work on together to make sure that we're building some of these things in, because we're still early in the thought process around where we can use AI and how we can use it. But we really have gone a little bit too fast in deploying solutions before we figured out where's the accountability,
Where
and
is the accountability?
what are those
Yes.
auditability layers really need to have built into them. But it's an important conversation, and I think I think 2026 is going to be the year that we start to figure this stuff out, because there's going to be urgency to it. I think, if people have been paying attention to what's happening in the legal area, there was a lawsuit filed recently in
Yeah.
California against
Oh
the health
yeah.
system because AI was being used. And the patient actually looked at their chart on their smartphone, and they saw some information that had been generated that it clearly stated that it was AI. And so ambient listening was being used. The patient was not aware of that. And this isn't even a language issue. This is something where the AI is basically kind of unchecked, and it kind of intimated that the patient had consented and the patient had not. Think
That's
about the impact of
terrifying.
something like it is, but this is one of the things that's going to really cause us to pay attention and start to figure out the governance and think about the policies that need to be in place to protect people, protect the
Yes.
patient, protect the clinician. Is something that people may not be aware of right now, but they will be soon, is that AI generated content that goes into a patient's record, it's not governed by HIPAA, and it's not under the FDA. It's under the High Tech Act. So,
Oh,
you, as a clinician signs off, they now have full liability for everything that's in that record. But the systems themselves, they have no liability whatsoever. So this is something we've got to pay a lot of attention to, and it's
yeah.
thinking just about the example I mentioned to just now. What if the patient can't read
What if the
English?
patient can read? Yes. What if this patient, I mean, this was only found out because the patient read that
That's right.
piece and was like, what? Right? No,
Exactly.
it to me is very scary. And this is why I would never stop emphasizing the importance of ethics. AI will
Yes.
never manufacture ethics for humans. We still need to emphasize that. And
That's right.
our professional core should always be that, which is in fact what
Yes.
makes a profession is the code of
That's right.
ethics. And this is all something I always
Yeah.
say when I emphasize the importance of language access done by a professional interpreter or a professional translator, is that you can
Hmm.
at least know that this person that's a professional has a code of ethics sort of
Yeah.
endorsing their activity, or um, you have that as a quality assurance of the on their delivery
Yeah.
of the service. So I
Yeah.
think that we should go back to basics, basically, emphasize ethics,
Yes.
talk about bedside manners, patient care, etc., and
Hmm.
not just rely on AI. I think it's so tempting to just rely on AI because I think humans are by nature a little lazy. So that
For
is,
sure. Yeah.
we're going to have to make an extra effort. So,
Something
mm,
just to kind of put a punctuation mark on this. Informed consent as a concept in
exactly.
healthcare is a very, very important one. And we are now just at the beginnings of this transformation to use AI. Um, a patient cannot consent to something they do not understand, and we do not want them to consent to something if they don't understand it. It is imperative for us in the process of obtaining their consent, that we are communicating with them in a way that they can understand, whether it's technology we're trying to explain, whether it's the clinical care we're trying to explain, or whether it's making sure that we understand if they have a an objection on any level to the use of ambient listening.
Yeah.
We can't assume those things, so we have to make sure that we're communicating in a clear way in a language they understand so that they can make an informed decision. We
Yeah.
don't trick them into something. They need to have enough information to make that decision themselves. We can't do that if we're only accounting for one language.
Yeah, and I wish there was a way, and maybe there is a way, and maybe this is a good question for you. Is how do we measure that effectiveness, for example, in the provision of language access? Because I see that many organizations do track interpreter utilization, but not necessarily communication effectiveness, right? So I think that a lot is lost when the systems only focus on volume instead of the of understanding the outcomes. Is there a way to perhaps measure that level of understanding? And if not, what do you think it gets lost?
There's a couple of ways that I think we can. In I suspect in some organizations they're probably already using survey information for this purpose. But there should be some things built into the patient surveys that go on. They're required. So if they're not metrics that are specific to that, then there are things that we should be actually putting in there. Um, there's an example of an organization, the product that's been designed by some brilliant people at Stanford, and one of the interesting things that they can measure clearly by how they're using their tool is they're actually seeing a marked decrease in no-shows and cancellations
Hmm,
and an
okay.
increase in patient satisfaction. Well, for me, that tells me that they've got something that's they've worked on that's really, really effective. One of the first
That's
things I
awesome.
asked them was, "How are you doing things, with regarding obtaining consent, and what are you doing for languages?" And I was really, really happy that they told me that they had just finished the module and it's now available in English and Spanish, and they're moving on to other languages. This is a really important thing that they've done because what they're doing is they've wrapped the capability around the patient's encounter. And there are essentially AI coaches that are helping the clinical teams to understand what's really important to the patient.
Hmm.
They're actually detecting sentiment so there's some voice analysis that's going on, which I think is really profound. But when I asked them, how are you dealing with the consent thing,
Hmm.
I was really, really happy that they're not just putting that on the physicians. They've trained their medical assistants to do that. And the experience for the patients has just been getting better and better and better as they've deployed it. When they come in to start the clinician starts their day, they've got a patient list, and it actually adjusts the timetables based on the complexity and the nuance of every individual patient that they're going to see. And if the last visit you had concerns about something, you had anxiety or fear,
Ah.
it knows this, and it's going to help you to align your schedule to make sure you are spending the right amount of time with each patient and you're meeting their needs wherever they're at. And language is another aspect to it. So even if you're just talking about English language, how
Yeah, I was
effective
just
is the
gonna ask
communication
you.
is the issue.
Yeah, I was just gonna ask if this was only primarily in English at the moment,
That was where they started, but they're now serving both English and Spanish
in
speaking
Spanish.
patients, and they're really aggressively working on additional languages. And by the way, when I spoke to them, I said, when you need some help with other languages, let me know. I have a really good friend that can help you with that. So
Oh,
I
that's
hope
so
that
awesome.
we'll be able to connect and help those guys with what they're doing. So I think the capability is phenomenal, and I think it's an example of how things can be done in a way that really do take into account the individual needs of every patient, whether they're speaking English or any other language, but more importantly, the effectiveness of the communication is built into how they're monitoring and managing the actual patients that they're taking care of.
See, that's key what you just said. They focus on the individual and the individual needs of each patient. And
That's
I
right.
think if anything, we should use AI for that with all the time that we're saving with using AI in other
Hmm.
categories, why not use it to improve patient outcomes, right? And
That's right.
focus on these kinds of things, focus on the anxiety that the patient felt the prior appointment and address it in the following appointment. That
Yes.
is an amazing use of AI. I commend that group for doing that. And I wonder if you know if in that case or in other cases, if they spot places where, for example, patients don't get the language help they need, and if they do spot these areas, um, how if they can use that information to fix that problem. Are they targeting this kind of information or no, or you don't know?
I haven't encountered any specifically, but again, I can refer back to my time at Northwell. I know that that's something that they were always paying attention to. They had a team that was really specifically focused on that because there's, I mean, it's a huge melting pot. There's people from probably every nation on earth, every culture is represented, every religious background is there. So it's definitely a heavy focus there. Um, and they would make adjustments, and I'm sure that they're still doing it. But that's an example. I don't think that every organization is necessarily in a position that they're handling it that way. Um,
Right.
I suspect over the last few years, for better or for worse, it's not a political thing, but we've certainly seen a lot of people coming into the U.S. from countries around the world, and I suspect there's probably parts of the country now that may be a little bit behind in doing this, but they need to be paying attention and starting to deal with it now, because you have people in your communities that you need to take care of, and the only way you can do that is if you can manage, adapt, and make sure that you have the ability to communicate effectively with them, make sure that they're understanding what they need to understand in order to help themselves get better. I mean, really basic fundamental things.
Yeah.
Human beings need to be able to communicate, and they need to be heard.
Yes, Chris, and I think that it's also important that as all of these technologies advance for the benefit of the limited English proficient person or the deaf and hard of hearing or the blind person, I
Hmm.
think it will start to replicate across the board, not only in the United States, but also everywhere else in the world. And that will um, guarantee that at some point that English speaking doctor, nurse, technician that travels to a country where nobody speaks English, well, although that's
Hmm.
even more and more difficult, but there are situations where they might find themselves in a country where English is not the dominant language, and God forbid they are in a situation where they have to go to the doctor, that those technologies
Yeah.
are also helping them. Because I think that one
Yes.
of the biggest challenges, at least from an advocacy perspective, is that we're talking a lot about limited English proficient person, the community, and all that, and somehow that has a tint eh, of negativity sometimes because it becomes not just an ethical issue on the part of the doctor, but it also is, oh my God, a burden and obligation, as I said earlier. And I really want to help people understand that if we fix this issue in the US, we fix it for everybody else and we fix it for ourselves whenever we travel and
That's right.
whenever we're in the receiving end of healthcare in a language that we cannot understand. I have had the fortune of traveling around the world, and there have been many situations where I feel illiterate, if you will, because I don't understand the language of the locality where I am. And it's scary. And it's scary for everyone,
Hmm.
regardless of your level of education, regardless of whether you're
Yeah.
a doctor or not. So I'm hopeful uh, in that sense, that when as we advance these technologies, they're going to be replicated, and
Right.
everybody's going to be able to use them and benefit from them. Mm.
No, I love that, and that's why the conversations that you're having, I can't tell you enough how much I really appreciate and respect what you're doing, because now is not the time for us to sit back and be complacent.
Yeah.
Whether we like it or not, we have the opportunity to make a lasting impact globally. And all the years that I've been in healthcare, I know that you have the same, thought as well. You want to make an impact, but you want to do it at scale. You want to leave something behind that you can be proud of. And I love that you're so passionate about making healthcare accessible to everybody. And I can't I can't tell you enough just how much I respect what you're doing, and I
Oh,
wholeheartedly support you.
thank you so much, and your support goes a long way. And yes, I think you included, are building something that hopefully is gonna last, a lifetime. And yes, Chris, I think that sometimes we focus on one aspect of healthcare and forget others. And for example, one of the things that
Yeah.
I've seen happening is that usually interpreters are left out of the equation, for example. So I remember, for example, when the new tower of the hospital I worked for was being built. Um, as in any project, I am a project manager professional. I have my certification, and I remember one of the lessons there was include every stakeholder in any plan that you do, right? However, when
Yes.
they were building the new tower, the language access service department was not included. And one of the effects of that is that when the tower was finished, they didn't think about they didn't think about the phone jacks for the Talk and Talk phones, which were used maybe 15 years ago, where
Right.
they had two receivers, and that created a problem. Like, why didn't they include interpreters of language or language services providers? Because they just didn't think about
Yeah.
them. So,
Right.
why do you think it's essential to include interpreters, language access coordinators, and frontline bilingual staff in AI readiness assessments and workflow design?
Hmm. It's unbelievably important, and I've had some conversations and been writing a little bit recently about the whole idea of not designing for, but designing with your people. And this is of critical importance, because as a technology person who's building a system, the intent is going to be good. I would never question that. I've only met people that are passionate about what they do. Fortunately for me, having been in healthcare for a number of years, but oftentimes we make the mistake of thinking we understand a workflow, or we understand what the need is, and our well-intended efforts actually create more friction, or they shift a workload from one place to another, but they don't actually resolve it. Um, it's important to include your translation services as it is to include your doctors and your nurses. Um,
Yes.
they're all places where there's workflows going to be impacted, and we're either going to improve it or we're going to make it worse. Now, if we leave out these kind of phone jacks for something basic that's actually used every day, I don't know what more even someone needs to see to realize there's a cost associated with missing that opportunity after the fact. And it's much more expensive when you have to go back and retrofit something because you didn't remember to include the people who are on the ground doing the work day in and day out. Whatever the level of services that they're providing, you need to make sure that that's accounted for and they have a voice in the room when you're designing. Don't deliver it if you haven't actually sat down with the people who are going to be using it to make sure that you've understood what they need and where you can actually relieve pressures in the workflow, as opposed to adding their reasons that they might have to use a sticky note to paste on things, or they're having to run down the hall to find someone who can actually interpret for them.
Yeah.
These are things that it can't be an afterthought. It just needs to be thought of right up front.
Yeah,
Include
and I
people when you're doing design. Don't wait until after. Don't deliver something to them. Have them help you design it.
it's always going to be more expensive, as you said. I wish
That's right.
people understood that because besides the human cost, which sometimes it doesn't catch the attention of many people, because as I said at
Hmm.
the beginning, they sort of look down to soft skills, unfortunately.
Hmm.
But even if you were to dismiss the soft skills, the human aspect, the ethics,
Hmm.
all of that, and just if you just care about the money, this is also important because of the
Right.
money and the economic impact. If you try to retrofit, as you say, anything or have language services as an afterthought, is going to be more
Hmm.
expensive, not only because you have to retrofit all the systems to fit the language accessibility, but
Right.
also because the mistakes, the adverse events in healthcare because of
Hmm.
communication barriers are going to cost you dearly. And we have examples of that. And the fact that they're not happening every day doesn't mean that they're not important. They're very costly. I talked a lot about the Willie Ramirez case, which there was a misinterpretation of the word intoxicated, and
Hmm.
it caused the patient to be quadriplegic, and it cost the hospital $72 million dollars. And this was back in the
Wow.
80s. So just imagine how expensive it is not to include the key personnel as you create all these systems. And Chris, I know we're almost at the end of our podcast, and I just want to ask you, what is your vision for the future in terms of what would a mature and ethically grounded AI and data ecosystem that truly integrates language access look like in practice?
If I can close my eyes and envision it, hopefully what we've done is we've removed the barriers for people when it comes to getting the care that they need. Um, you talk about preventive medicine, for example. There was so much focus on that at one point. We were trying to shift the paradigm so we don't wait for people to get sick. We're trying to be proactive. When it comes to what we're trying to accomplish with healthcare, we want to make sure that we're improving outpatient outcomes. That's obviously the main objective that we have. Um, but there are certain things that are, again, part of doing business. It's the cost of doing business, and I want to make sure that what are the things that we can do to equip our clinical teams with the best technologies, the best capabilities that we can give them to provide a level of care and a level of human uh, connection that every person can actually have a positive experience and get the care that they need. They feel comfortable, they feel trusted, they know that they're heard, they're understood, and they matter. And so everything that we can do to wrap all of our technologies, all of our efforts around the encounter itself, where the patient and the doctor, patient and a nurse are able to communicate. It starts from even the first point of access, whether maybe it's a referral center, maybe it's in the ER. But I want to see us make big strides in 2026. And if we have to slow down to fix some things, let's go ahead and slow down to make sure that we do it and we do it right. Because at the center of all of this, the only reason any of us do what we do, it's for human beings. And let's start with the fact that we all have the same basic needs, and being heard, being understood, and being able to communicate effectively. These are things that we all care about. And so we really want to make sure that we refocus. If we've kind of gotten off the path, let's refocus on that. And let's make sure that we're wrapping everything that we do around that encounter and the basic needs that people have to be heard, understood, and to receive the care that they deserve.
That's amazing. Thank you, Chris. I do feel that as your vision becomes true, more and more people are going to be also empowered to ask for this language accessibility. I think there's a lot of fear, especially now with the current idea that we only have one official language. And I hope you always ask for, I mean, we as humans always ask for visions that is 5 years out. You're bringing it to 2026. And I love that, because if everything is speeding up the way we see that's happening with the AI in particular, why not bring that vision even closer, right? Why not change the
Yeah.
culture even sooner? So I love that.
Yeah, there's no
Thank you,
time
Chris.
like
Yes,
today. I mean,
there is no
let's do
time
it
like
now.
today.
We have a great opportunity before we get way too far down the road and spend millions of dollars to only find out that, oh wow, we missed some really important things. We've done that a few times in healthcare over the last few decades. The electronic health record was probably one of the better examples. We intended to improve things, but we've actually just introduced more friction and more administrative burden to the people who are only in doing what they're doing because they wanted to be able to help people be healthy and get well.
Exactly.
We
Thank you,
had the right
Chris.
intentions, but it was not done quite the way it should have been.
Right. And let me say, I am very inspired by your work as well. And I was delighted to have you here and to overlap many of the aspects of our work. It's something that I look forward to. So this conversation with Chris Hutchins reminds us that innovation without inclusion is not progress, and that no amount of AI sophistication can compensate for broken communication. Language access is not a nice to have, and is not separate from data strategy or patient safety. It is foundational to trust, informed consent, and quality care. If you are a healthcare leader thinking about AI analytics or digital transformation, this episode is an invitation to pause and ask a deeper question. Are we designing systems that truly listen to every patient? Thank you for listening to Language Access Matters. If these episodes resonate with you, share it, subscribe, and continue the conversation. Thank you so much, Chris, for being here today.
Well, thank you for having me, Carol.
And that wraps up another enlightening episode of Language Access Matters. We hope you have enjoyed our discussion on the profound impact language access has across various sectors of society. Let's remember that language access is not just an isolated topic. It intertwines with various fields, impacting lives and businesses in profound ways. As we continue this journey together into becoming a more inclusive society where we ensure equal access to services to those who don't speak the dominant language, we want to assure you that our company, Equal Access Language Services, through its podcast Language Access Matters, will be with you every step of the way. We are committed to bringing you thought provoking conversations, expert opinions, and stories from the field and beyond. To dive deep into the subject matter and engage with leading experts in the field, we will release a new episode of Language Access Matters once a month. By featuring expert practitioners and individuals with diverse experiences, we aim to broaden the scope of our discussions and present a comprehensive view of the importance of language access. We encourage you to stay connected with us through our website, www.equalaccesslanguageservices.com, and our social media platforms. You can join the conversation, ask questions, and share your own stories and experiences. If you want to be part of our podcast, email us to podcast@equalaccesslanguageservices.com. Remember, language access matters to each and every one of us. By understanding its significance and actively working towards its advancement, we can create a more inclusive and equitable society. Thank you for being a part of the Language Access Matters community. We appreciate your support and look forward to sharing more knowledge, inspiration, and empowerment with you in our future episodes.